everyone, and welcome to another informative series on prostate cancer awareness brought to you by IHW Council and supported by AstraZeneca Pharmaceuticals. I'm your host, Resham, and today we have with us Dr. N. Raghavan, a senior consultant urological surgeon and uro-oncologist from Apollo Cancer Hospital, Chennai. Dr. Raghavan brings extensive experience and expertise and will guide us in unraveling the misconceptions and truths about prostate cancer. Where prostate cancer is actually a subject rife with myths that can lead to confusion as well as concern. So, in today's particular segment, we aim to confront these myths directly, offering clear and factual information to enhance your understanding of this particular disease. So, we will be discussing everything from risk factors and symptoms to the effectiveness of various treatments and measures. So, let's embark on this enlightening journey with Dr. Raghavan to differentiate between the myths as well as the facts about prostate cancer. Firstly, thank you so much for joining us, Doctor.
Thank you. Namaskar and welcome. I'm happy that I'm in the show.
Okay, so now I think it's time that we dive directly into our discussion. So, Doctor, let's begin by addressing some misconceptions, like I mentioned earlier. So, in your experience, what is the one major myth about prostate cancer? And can you tell us one of the actual facts as well?
I would like to say that there are two extreme myths which are very common in our population in India. There is one myth which believes that prostate cancer doesn't kill patients. And people say, oh, that's okay, we can wait and that's all right, and things like that. So that is one extreme. And the answer to that is sadly, prostate cancer in our country definitely kills patients. Roughly 6 out of 10 patients diagnosed with prostate cancer eventually die of the disease. So it's definitely a problem in our population. That myth has been perpetuated from the literature in the Western population, where we find that majority of patients don't die of the disease. The second extreme, on the other side, believes that prostate cancer doesn't happen to us. That's one extreme, and this is the other extreme. The sad truth is that prostate cancer is very common in our population as well.
Okay. So many people believe that prostate cancer is actually an older man's disease. So what do you have to say about that?
It is not a young man's disease. And I believe that any human being is as young as in their heart. So just because you're getting a disease in a 60-year-old doesn't mean that they are not going to live for the 20, 30 years beyond. So the age as a factor, we should not link up. It's a common disease amongst people above 50, 55.
But then if there are any genes involved, like it's a genetic thing, then?
There are some genetic components to it, but those genetic components are not that prominent in Indian setup. In our population, the amount of patients that are influenced by genetics in prostate cancer is not as high as you find in the Western population. In our population, we are finding more often sporadic disease. It happens in one member of the family and another member of another family, and that's all. It's not like one family gets 5 members with cancer. It just is more sporadic in our population rather than happening in a cohort of a family.
Okay. So like there's a common perception that prostate cancer always show clear symptoms early on, like in the early stage. So is that true?
That's absolutely not true. This is truly a myth. Prostate cancer, and for that matter, almost all cancers in the early stages do not show symptoms at all. They are picked up just because we screen for them. We do some tests we call health checkup or healthy man checkup, a healthy women checkup. That highlights a particular blood test or a problem, and then from there onwards, we diagnose the cancer. So it's a complete myth to say that early prostate cancer presents with symptom. Sadly, many patients with symptoms have advanced cancer. So the intent of programs like this is to convey the message to the population to say, please do not wait for symptoms to onset. Instead, be upfront and do a health check on a periodic basis, say every year, and make sure you pick up those problems much early, be it for prostate cancer, be it for diabetes or blood pressure or anything else.
Okay. So, like you mentioned in this particular answer, that, it's only after a screening that a person gets to know about it. So, let's talk about screening. So, is it true that all men should get regular PSA test after a certain age? Like, what do you recommend?
I will tell you what is being recommended in the international community, and I'll tell you what is being recommended by Dr. Raghavan. I'll be very honest about that. In the international community, where the literature is primarily driven by the Caucasian Western population, screening is not regularly advised. In fact, what is being advised is called smart screening, where you screen only if necessary and so on and so forth. And that's because prostate cancer is more common than our country and doesn't kill patients that often. And therefore, such a program is quite legitimate. However, in our country, we are still way beyond that. In our country, the majority of the patients we diagnose with cancer, advanced cancer. So I believe that in our country, screening is far more important in order to make sure that we pick up the patients much earlier than where we are at this point of time. At this point of time, we are getting patients with very advanced cancers. We want to move it, towards the left, where we want to pick up much more earlier cancer so that we can cure them. That is not there in our country. So hence, for our population in India, I would prefer that we have at least some form of screening to patients who come to the OPD, where we do a blood test called PSA.
Okay. So with that, like, this is very basic, but I think that's really going to help our audience get more insights of the same, which is that some say that diet doesn't really affect prostate cancer. Can you explain the connection between your diet and the prostate cancer?
You mean the hair dye?
No, diet.
Diet.
Diet, yeah.
Diet. See, the prostate cancer in our country, or for that matter, even in Caucasian population, there was some research which suggests that environmental carcinogens, as well as some of the dietary factors which contain slightly higher amount of certain hormones, can drive the prostate cancer upstream and may, precipitate a cancer. There is some association, very tiny, but that doesn't mean that one has to go on a full yoga diet. It's definitely healthy to be, having a proper balanced diet, which is quite always recommended, but you don't need to go completely mad about it to make sure you don't deprive yourself of the normal joys of a diet.
So, doctor, how true is it that the treatment of prostate cancer can lead to major side effects like impotence, to name one of a few?
Definitely, that's not myth at all. That's very true. When you have a cancer affecting the prostate, and treatments thereof will have an impact on two things. One is incontinence, meaning leakage of urine during cough or sneeze, and impotency, ability to have a penetrative intercourse. Having said that, both are surmountable problems. The good news is that the vast majority of the patients who initially experience incontinence will become continent with time. Less than 3% of patients after a year or two will experience any form of incontinence with the treatment. So the majority of the patients do very well. That's number one. Number two is the impotence. Yes, that is very true. Patients do get affected by that, especially if they have an advanced cancer. The treatment will have some side effects, including impotence. However, the modern technology, modern treatment are good enough to allow patients to recover the potency with some help to make sure that they are back to the normal life very soon. So yes, it is true. However, both are treatable and manageable.
Okay, so both are treatable and manageable. Okay, so good to hear that. So, doctor, there's a lot of talk about natural remedies for prostate cancer. So, what's your take on that?
I'm not objected to any form of alternative medicine. We call alternative medicine or integrated medicine, whatever the names you. That includes naturopathy, Ayurveda, yoga, homeopathy, and so on and so forth. I'm not particularly against it, but they are not going to cure your cancer. No. You need a treatment which is either surgery or radiation to cure your cancer. And in addition to that, if you're going to take any of those things which you believe will help you, I particularly don't object to it. However, to believe that that will cure the cancer is a myth.
It's a myth, totally. So, finally, for those who are watching or who may be going through this journey, what's one key fact or piece of advice you'd like to leave with them?
Cancer is not the end of life. Cancer is a beginning of a new journey. You will finish the journey and then you will realize that you become the leader for many more people who are in the journey. So, cancer is not something that you need to dread about. It is something we all need to face and deal with it. And once we deal with it effectively, the vast majority of the prostate cancer patients survive well and will be there to tell the story to another one. So, you don't need to lose hope. There are fantastic treatments available. And yes, it's a journey, but we will be able to be successful.
Okay. So, as Doctor rightly said, that cancer is definitely not the end of your journey. And as we come to the end of this particular and engaging discussion, I'd like to thank you, Doctor, for your valuable insights and expertise in debunking those myths about prostate cancer. Thank you so much for being a part of the session. And thank you, Doctor.
Thank you so much. Pleasure.
Okay. And to the audience, stay tuned for more informative sessions about cancer.